Hi, my name's Dr. Jon Behr. I'm the Chief Medical Officer at Vision, and I'm here today to show you some really exciting developments in our new clinical app, Vision Anywhere. Most of you will know that Vision Anywhere is already out there being used, using real patient data. Currently, it's got a mobile use case, but over the course of 2017, we're introducing significant new functionality to enable you to start using Vision Anywhere on your desktops in clinic to be able to see patients throughout the day. Vision Anywhere gives us an opportunity to really have a think about how we are enabling GPs to perform certain processes. And I want to show you one example today of how we are introducing new types of functionality rather than simply maintaining a like-for-like replacement of what you see currently in Vision 3. So this is a design for the functionality that's coming, and I like to call it repeat sync for now. When I joined Vision about 18 months ago, ever since then, the most commonly requested functionality from colleagues, from GP colleagues, has been the ability to easily synchronize medication. So repeat medication that is set for 6 months, 12 months. When patients are on lots of those repeats, it's quite common for them to all run out at different times. And the practice therefore has two choices. You can either spend a lot of time trying to do the synchronization manually so that they all have the appropriate quantities to run out at the same time, or not. And the problem with not doing it is that you often get appointments that are ostensibly for a medication review, but when you come to look at it, what's triggered that whole process has been perhaps 1 out of 10 medications that's expired in terms of the number of issues, and really the patient didn't need to be there, which has led to a wasted appointment. It's led to wasted admin time to try and make that appointment, and it's hugely inefficient. The other alternative, of course, is to manually synchronize them, and that takes a significant amount of time. So we have a solution, and what you're going to see here is not wishful thinking. The engine that's driving this solution has been developed, it's been tested, and it's ready to go into Vision Anywhere. So when I go to reauthorize in Vision Anywhere, you might get this type of scenario. You have various drugs with various supplies and issues against them. Some might have repeat until dates, but most probably won't, unless you're doing batch prescribing. So if I was to reauthorize at this point, you would still continue to have medication on repeats that are likely to run out at different times. With repeat sync, we're trying to solve that problem with 2 easy clicks. What you're looking at here is Vision Anywhere working out which medication can be synchronized easily and those that can't. Because we live in the real world, and whilst I would like every single medication to be able to be synced automatically, in reality, some are very difficult to achieve that with. So for example, eye drops. Patients are going to spill them, they're going to drop more in than they should. Same with creams. How much are they actually going to use per dose? And then you have things like insulin, which can vary significantly month to month, and inhalers, which again could be used very heavily 1 month and not another. So what Vision Anywhere can do is work out those that are very predictable. So where the dosage instruction is consistent, and when they are not creams, they are not drops, they are not inhalers, it will know to include them in those that can be fully synced. And by that I mean the supply calculated, the issues calculated, and the repeat until dates calculated. So in reality, most medications will fall into the top table, and those that can't be synced are fewer. So, as I promised, there are 2 steps that you need to do to synchronize all of these medications, whereas before there would have been at least 3 steps per medication. You need to define the duration of treatment, and you will have options between 1 month and 12 months, or run it to the month of birth. In this situation, I've created a scenario where you're going to select a duration of 6 months. You then just have to tell the Vision Anywhere how often you want the patient to pick up those prescriptions. So this will allow you to create en masse a set of Dosset box type prescriptions if you wanted to prescribe for 7 days, and you can go up to 3 monthly. In this scenario, I've selected monthly. And watch what happens when I tap on monthly. You'll see that the supply and issues has been calculated. The repeat until date has been entered for all of the medication. And I've kept these fields as illustrations just to highlight the fact that you can edit any of these fields still. You're not locked into what Vision Anywhere thinks. Vision Anywhere will remember the previous supply and issues for those that can't be synced. And the chances are you won't want to change them too often. But if you really want to, you can. And then you can include those medications. So that's essentially the process. 2 clicks to synchronize your entire list of medications. That's all very well on that day, but a common question that's put to me at this stage is, well, what happens 2 weeks later when Joyce Jones, who is a fictitious patient, by the way, is started on another repeat medication? By definition, that new repeat is suddenly out of sync. Well, we've included a solution for that too. If I go to prescribe that new medication, I'm now 2 weeks later in the process. So I'm prescribing Lyrica. The exact same principles can apply at the individual drug level. So if I make this a repeat prescription in Vision Anywhere, what it will do is look for that repeat until date that has been entered in that repeat sync process. It will look for the date that occurs the most frequently and synchronize the medication that you're now prescribing to that date. So it will work out the number of issues and the quantity for that. And again, it's fully editable if you don't want to do that. Now, it might be because you're 2 weeks into the month that actually you need a certain number of tablets or capsules to see you through until the point at which you should start taking the doses in sync with the existing repeats. So if you want to be really, really precise about it, Vision Anywhere gives you the option to prescribe a smaller number and then set up the repeat as a date in the future on which to start. So if you really wanted to be precise, now it might be that the patient says, well, it's okay, doc, I've got enough, or that will see me through. But it's there if you want it. And if you don't want it, you can easily remove that. So this isn't a pipe dream. This will be reality in Vision Anywhere within the next few months. And if you've got any feedback, if you want to ask further questions about this particular feature, then don't hesitate to contact me at jonathan.behr@visionhealth.co.uk. Thank you.